It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies. We also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated adults and children with tracheostomies, otherwise medically complex patients at home, including home BiPAP, home CPAP, home TPN, IV potassium and IV magnesium infusions, as well as IV antibiotics at home. So we cover the whole range that's available for patients in intensive care at home. We can do that at home. So in today's blog post, I want to answer a question we get quite frequently. How much does it cost to bring a patient on life support from intensive care home and be cared for at home? And that is a great question, and a question we get quite frequently. And the answer that I'm going to tell you is probably not what you expect. I will give you a monetary term in a minute. However, before I go into the financial side of things, I do believe that what we do with our service, intensive care at home, is absolutely priceless, and you can't put a monetary term on what we do. The reason I'm saying that so confidently is ask our clients. Ask our clients what's the alternative for them to stay at home. The alternative for them is to go back into an intensive care unit, going through the emergency department, and nobody wants to do that. So, the alternative for our service, intensive care at home, is to go back to intensive care. And that's not a good outlook. Most of our clients have lived, quote unquote, lived in intensive care for months, sometimes for years. And they certainly do not want to repeat that exercise. Now, looking at the cold hard facts in terms of how much does it cost. So an ICU bed costs around $5,000 to $6,000 per bed day. Intensive care at home costs around 50% of that. So whilst I think it's priceless what we do, those are the facts. We are currently operating all around Australia. Our clients are accessing funding for nursing care, for 24-hour nursing care, mostly through the NDIS, but we are also we're also a preferred provider for the TAC in Victoria, iCare in New South Wales, and IISQ in Queensland, as well as the DVA, Department of Veteran Affairs. We have also received funding through Departments of Health or public hospitals directly. So, but on top of, again, how much does it cost? It's about the quality of life. In some instances, about quality of end of life. It's not, you can't put a monetary term on that. On top of that, for hospitals, they need intensive care beds. And how much is it worth for them to have an empty intensive care bed to treat someone that is in dire need of critical care? Imagine there are bed blocks, right? And people can't access critical care because long-term ventilated patients block an intensive care bed, whereas they can go home with our service. I hope that answers your question. Yes, half of the cost of an intensive care bed, but it's priceless what we do. Now, if you have a loved one in intensive care, especially long-term ventilated with a tracheostomy, and you want to go home, you should contact us at intensivecareathome.com. If you are an NDIS support coordinator and you have a participant that is in a dire situation with ventilation tracheostomy, even if they're not ventilated but have a tracheostomy, if they don't have a tracheostomy but need BiPAP, CPAP ventilation, they need an intensive care nurse 24 hours a day to get them out of hospital safely. If you don't provide that type of care at home, they are at risk of dying, just to be very clear there. And we have seen it if patients don't have 24-hour intensive care nurses at home when they are ventilated with a tracheostomy, or if they are having a tracheostomy without being ventilated, or if they're on BiPAP, CPAP, they are at risk of dying if they're not having 24-hour nursing care with intensive care nurses. This is evidence as per the home mechanical ventilation guidelines that you can access on our website. They're evidence-based. Everyone in those situations needs an intensive care nurse at home with a minimum of 2 years ICU experience, 24 hours a day. We are also providing our own NDIS support coordination level 2 and level 3, which includes the specialist support coordination. So if you need access to an NDIS support coordinator, including NDIS specialist support coordinator, please contact us as well. You might be at home already and you might have insufficient support or insufficient funding. Please contact us at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. If you are a critical care nurse and you're looking for a career change, please contact us as well. We currently have jobs in Victoria, New South Wales, and Queensland, but we are operating all around Australia. You can contact us with your questions and inquiries. If you are an intensive care specialist and you're looking for a career change, we are currently expanding our medical team, and you might have bed blocks in your ICU and we can help you eliminate them. If you're a hospital executive watching this, you can contact us as well. Again, if you have bed blocks in your ICU, if your EDs are overcrowded, please contact us as well. We are also providing an ED bypass service for the Sydney Western Area Health District. So we are also sending CCRNs into people's home to keep emergency departments empty. Now, thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, comment below what you want to see next or what questions and insights you have, and share the video with your friends and families. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.